So one thing that a lot of people have talked about when it comes to the healthcare reform or the PPACA is the individual mandates and also the state mandates. And it's a lot of controversy right now, and those aren't just the only issues, but that are being debated. But other issues when it comes to insurance companies, and pharmaceutical companies. But the two main ones that a lot of people usually worry about are the individual mandates and them being told that they have to purchase health care. And this kind of goes, there's pros and cons to both sides of the situation. Yes, some people don't really utilize healthcare very much and they stay healthy as oxes all the time and they're great. But the real true picture is that most people in the United States are not necessarily at their healthiest that they can be, and especially not people that are in low socioeconomic statuses. And so the mandates is the only sustainable way for us to actually fund a healthcare reform. So when it comes to the individual mandates, for the people that are middle class, rich, this really won't really affect them. They can still have their own private insurance companies, and they can still get the care that they always wanted. But this really helps a lot when it comes to the poor and low socioeconomic status individuals. Actually gives them the opportunity to actually hold and actually take hold of their own health care. So that's really where those individual mandates are coming from. And actually, for the people that can't afford, which I know is a big issue, like what if I can't afford health care, the government has ways of subsidizing those costs and actually really only taking about 2.5% really of your income to actually subsidize those costs, which in the holistic realm of your income is not too much money. Most people don't need to see it taken out, like all the stuff that's taken out of taxes, it'll be that extra 2.5%. And one thing that also other people are talking about, or more, I guess, state legislations are the individual state mandates, which actually force states to actually create these exchanges, and also forces a lot of health departments within the states to actually do community health assessments. Not just from we're going to do an assessment and we're just going to pick and choose which ones we think are best, but actually doing a holistic community assessment to see what factors actually affect a region, a state, a county, a city, and actually put forth a plan that actually addresses the main concern. So each state will be a little bit different. Some states, they may have a high population of cancer patients. Some states might have chronic heart disease. Diabetes could be another state. And the whole idea of the exchanges and also the state mandates is to really address those core issues within their states. Because when it comes to public health, the states are the main distribution points when it comes to public health services and actually providing for its individuals. So the federal mandate really just is encouraging states to really address public health as a concern overall.